Well, we want to get back to our conversation about making sure guns are safely secured and out of reach of children.
That's right. We've been following two horrific cases this week that involved kids, both 2-year-olds becoming the victims of gun violence. And today we're getting insight from an expert.
That's right. Julia Fleckman is the Associate Director of Tulane's Violence Prevention Institute. Thank you so much for being with us for this conversation this morning.
Thank you for having me.
First, tell us a little bit more about the Institute and the research, which actually involves several studies and partnerships.
Yes, absolutely. So as part of the newly formed gun violence prevention lab that we have within the Violence Prevention Institute, we're really trying to address gun violence from a research perspective, particularly thinking about it from a public health perspective. And so we have a number of studies going on trying to understand some of the factors that influence gun violence, as well as some of the better ways we can think about prevention and intervention to sort of disrupt the cycle.
And what have you learned? I know you guys have been working on this for about 2 years.
Absolutely. Two of the big things we've learned are gun safety. There is a really big, I think, misperception around locking up weapons and not having easy access, right? And when in fact, storing your weapons properly can save lives, both in terms of we've been seeing over the past couple of days,
right,
with young kids having easy access to loaded weapons in the car. If those had been properly stored in a lockbox, the child would not have had access and you wouldn't have had those unintentional injuries. And it's also a really important piece to think about when we think about suicide prevention as well.
Sure.
Absolutely. So that's one big thing we've learned. We've also learned too that I think there, our fears are, people think they want to protect themselves, right? Absolutely. And so carrying a weapon is one way that they see as being able to protect themselves, when in fact, really the research shows that it really may increase your risk for being involved in a shooting incident and being harmed.
And I know that another interesting part of this research is you guys are actually working with the hospital, University Medical Center, speaking with people impacted by gun violence. What are you learning from that?
Absolutely. So we're just starting a big project with the University Medical Center, and we're trying to provide support to victims of gun violence in particular. And I think what we're learning is that folks oftentimes in that situation, they want to react and potentially retaliate, right? And that might be a potential moment for us to really stop that cycle, right? To prevent that from happening and to provide folks with the support they need to recover and to heal as well. It's a very traumatic incident if you're shot, right?
Sure.
And we need to be able to provide the types of support, and not only mental health services, which are a big impact here, but some of the things that might have led to the incident to begin with. Folks need access to educational resources, to job training programs, to safe and stable housing. How do we really help improve access to those basic services?
Yeah, what I appreciate about your conversation and your research is it does get to some of those roots of gun violence, because often, even as the news media, right, we promote this idea that putting more police in neighborhoods is what stops gun violence. And that's not what research shows.
It's really not what it shows, when in fact, if we really think about the economic drivers for this, the racial discrimination that might be driving this, and how we really kind of address those pieces, and how we address, I think, also understanding what those root pieces are to drive forward policy change. I think that's what's really going to make this conversation different.
And I know the research you're doing is unlike, or you guys are the only people in the Gulf South doing?
Right, so we're the only institute of our kind in this region, and really one of the only violence prevention hospital-based interventions in the region as well. We don't really see those. They're something that are really being promoted nationally, so we see them in places like the Northeast in California, but we haven't seen that where gun violence is particularly bad in the Gulf South. We need more of these programs, and this is really the first of its kind here.
And are you seeing progress?
We are seeing a little bit of progress, but I think it's going to take a couple of years for us to really see the impact. And I think it's easy for us to get caught up in, like, we need to see this immediately, because it is bad. It is bad right now. So I think the hospital piece will take a bit of time, but something I do think that will have more immediate impact is really talking about and educating people about gun safety and promoting the use of lockboxes. These days you can purchase a biometric lockbox that's very small that can fit in your car. That's fairly affordable. It's $100, but we're also going to be trying to distribute those. I'll have further information later that I'll definitely pass along about how we distribute those community-wide and how we educate, I think, folks around some of the misperceptions of, like, it's still very easy to access your weapon when it's properly stored. It's just going to prevent those incidents where you may not mean for that to happen. particularly what we've seen over the past couple of days.
Julia, some very important research here. Thank you for sharing your findings and adding to this conversation. And yes, please pass along that information when you guys do some gun safety distributions. Thanks for being with us.
Thank you.